Hi, everybody. I'm joined today by Karen, the executive manager of our Nottingham
Hello.
branch. Lovely to have you today, Karen. And
Thank you.
Karen is joining us to talk about dementia. And before we get started, I just want to share some stats around dementia. Because I'm sure, unless it touches you in terms of people that you know through your family or friends, um, we don't tend to know an awful lot about conditions such as this unless we become sort of immersed in it, which obviously is not what we want. But according to the Alzheimer's Research UK, there are 944,000 people within the UK with dementia, diagnosed dementia. And that number is the highest number that we've seen. And sadly, that number is set to increase to over 1 million by 2030 and over 1.6 million by 2050. And due to the gradual nature of dementia, the mild early stage symptoms and the low diagnosis rate, it's difficult to know the exact number of people living with the condition. But again, according to the Alzheimer's Research UK, anyone born today, in fact, actually 1 in 3 people born today in the UK will develop dementia in their lifetime. Now, there's some scary stats there, Karen, isn't there? I
hmm
mean,
Yeah,
I was
truly horrible.
staggered before our call when I was looking at this. But I think it's really important to set the scene just to kind of give some context to the condition that we're hearing more and more about. So, again, thank you very much for joining us because it's much appreciated. Um, Karen, do you want to just introduce why you're on this call, first of all,
Yes.
so that people know a bit
No
more about
problem.
how involved you are with dementia?
Yeah, absolutely. 4 years ago now, my mum was diagnosed with dementia. And as a consequence of that, I wanted to find out more about how I could support my mum, but also my dad as well. So my family with the disease, because it's not just about caring for someone with an illness. It really is a very progressive disease that comes with additional challenges. So I wanted to find out more about it. So I became 3.5 years ago a volunteer ambassador for Dementia UK, which is a volunteer role that I do alongside my normal day job, so to speak.
Amazing. I mean, gosh, I don't know how you fit it in, if I'm honest with you, but thank you very much for sharing that.
That's okay.
So, for the benefit of the audience, which will be our colleagues across Tate,
Mhm.
and obviously anybody outside of Tate within RSS as well, potentially, what is dementia, and what are some of the most common types of dementia? Because there's more than one, isn't there?
Yeah, absolutely. It's dementia is an umbrella term that they use to describe a range of progressive conditions that affect the brain. That's the medical term. Most people say that what's the difference between dementia and Alzheimer's, because they're the two that most people have heard of. So there are actually 200 types of dementia, and Alzheimer's is one of the types of dementia. The most common ones, as I say, being Alzheimer's, vascular dementia, and mixed dementia. So that's the difference between the two.
My goodness me, you've taught me something I didn't know there. You're absolutely right. I thought it was dementia and Alzheimer's. I had no idea there was 200 types.
No.
Wow. Okay. So what are the early signs and symptoms of dementia?
Okay, the biggest things that you notice, short-term memory, concentration. As somebody sort of starts to go down the dementia route, communication and understanding of words. I think the biggest thing from my point of view is changes in personality. So changes in people's mood, behavior, or how they are socially. Those are the big things that people notice first off.
Yeah. Are there more symptoms as well, or they're the main symptoms that you would
There
tend to
are, yeah,
see?
those are the
Yeah.
ones that you notice. I mean, I could go through for hours and talk
Yeah, I
about
can
the different
imagine.
things that, my mom had, the traits of dementia, but those are the most common ones for people noticing things early.
Okay. And so how is dementia, in your experience, then
Mhm.
diagnosed?
Okay. Obviously, you notice those traits in somebody. It's quite a long-winded process, I'm not going to lie. Initially, a GP appointment, and then a GP will refer the person to a memory clinic, and it is at those memory clinics that they diagnose if somebody has a type of dementia. So it has to be a medical, obviously, process as well. You have to go and see your doctor first.
Yeah, to get that referral through to the specialist.
Correct. Yeah.
Yeah, I understand that. Um, what are some of the strategies that you're familiar with for managing challenging behaviours with someone with dementia?
Yeah, these are really difficult, and I think even people within the caring environment do struggle a bit with some of these. But distraction is a big thing for somebody with dementia. So make them a drink, have a snack, turn music on, or go out for a walk. So it's distracting them from what they are actually doing, from the behavioural issue that's coming out. A big thing for people with dementia, they don't like a lot of noise. So if you are in a really noisy environment, try and remove all noise. They like quiet. I don't know why, but they do. Um, Shorter sentences and sort of communicating in quite a simple way with simple instructions rather than anything too complicated. I think those are the ones that we did with my mum first, which seemed to work
I suppose it's a
initially.
bit of trial and error initially, isn't
Very
it?
much
Trying to
so.
find what
Yeah.
works.
Mhm.
Yeah.
Yeah, very much so. Yeah.
And I've heard of things like taking along old pictures and memories as well. That's another thing.
Yeah, you can do. Generally, people with dementia find themselves in any part of their life. So to
Hmm.
explain what I mean by that, um, my mom, for example, can be the age my mom is. My mom is 81. Um, you can possibly get my mom at like 40. So she thinks she's 40. You can also get her when she's in her child stage. So she thinks her parents are alive. And so showing photos can be good if you are in the right time zone. That
Mm,
sounds really weird, but actually that's true. So the time zones are actually really, really a part of the dementia and just how they become. So yeah, sometimes she recognises pictures of me and my sister. Sometimes she doesn't. Sometimes she doesn't recognise pictures of her own parents and things like that. So yeah, you never know what you're getting.
yeah, like you say, it needs to be in the right time zone, I guess.
Very much so.
That does
Yeah.
make complete sense. Goodness me, there's a lot to think about, isn't there?
Yeah.
Um, how could someone help, in addition to what you've said, how could someone help um, someone with dementia maintain their sort of independence and quality of life? Because that must be really hard.
It is, and somebody being within the home environment, it is quite difficult. So, I think obviously, if someone is in the home environment, first and foremost, making sure that they're safe.
Hmm.
So, for that, I mean identifying hazards, so and removing sort of items that potentially could be a hazard, labeling things like tea and coffee jars and things like that. Sounds simple, but really important. I mean, my mum did things like put an electric kettle on top of the stove, so removing things like the kettle from my mum's reach and things like that. It's difficult to do for sure, but yeah, just removing hazards within the house. Sometimes, you need somebody from sort of like more of a social services background to come and have a look at the home to see if there's anything extra they need, to help them get in and out of the shower. It depends what support they've got at home and things like that. So, but also ask family and friends to help as well. I think a lot of people struggle on and think, do you know what? Yeah, I'm looking after my mom or my partner or whoever it is. Actually, you don't have to do it all on your own, so just ask for some help of people. You'd be surprised how many people can have been through situations like this. But if not, go to somewhere like your local council, social services, that type of place. Age UK are pretty good.
Yeah, I was going to say, because it's not just the person going through it, it's the person that's supporting the person going, or
Hugely.
people.
Yeah.
Such an emotional challenge, isn't it?
Yeah, completely.
What advice would you give to someone that has that emotional burden? I mean, I don't mean it in a
Yeah.
horrible way, but
No, I know.
it's a big
Yeah,
responsibility and
I
accountability when
understand
you're
that.
dependent upon someone.
Yeah.
Um,
I think you've hit the nail on the head. I think to sort of give an example, my dad will always say that he's got dementia too. My dad does not have dementia, but because he is living with it daily,
Hmm.
it is like him and my mum have both got it because they're both living with the disease. So I think anybody that is caring for somebody with dementia will undoubtedly feel exhausted. It's relentless. It genuinely is. So you will feel exhausted. You also might feel a bit guilty that you can't be with that person day and night because
Hmm.
it's such hard work. A lot of people resent the fact then that they're caring for somebody, which is not ideal because you just want a bit of time for yourself occasionally.
Yeah.
And to not feel like that, I think because you're so tired, because you're frustrated, sometimes you have it, people can get a bit angry with the person with dementia, which is not the right way to be at all because for the person with dementia, they don't understand why you're getting angry with them. I think that you have to constantly rethink and re-look at the options that are open to you. I know speaking to a friend, she said, I feel so dreadfully guilty because, it's my dad has got to go into a care home, but you also have to think about how that is affecting you as a person as well.
Mhm.
So, completely rethinking things and just refreshing the situation as often as you can, just to, because there are other options available to you. Because, as I said before, you're not on your own. There are support services out there that can help.
And I think that leads me nicely onto my next question, which is about support groups and resources.
Yeah.
Because, like you say, with any condition, there are groups of people that are out there that are more in tune with what's going on. What
Yeah.
support groups, in your experience, have you used, and what resources are available that people can tap into?
Okay, well, the main one for anyone with dementia is Dementia UK.
Yeah.
I know from first-hand experience, the website is so easy to use. It's really sort of step-by-step instructions. You can make virtual appointments now, which, with the current situation with going to the doctors and how long things take, is actually really good. So you can do a virtual appointment with a trained person on the other end of the line. Now, most people have heard of Macmillan nurses, but Dementia UK have Admiral nurses that support them. They are an absolute lifeline to anybody who is the carer of the person with dementia. So they are trained to give the family advice and support as to what to do, from practical tips, around the home, as we've mentioned, emotional support, but also sort of signposting you in the right way for things like financial support, because that's an absolute minefield when it comes to the financial side of things for someone who has dementia. So they can give a whole range of advice. I also used Age UK. They were very good as well, but they are obviously not specifically for people with
Mhm.
dementia, but they are extremely helpful. And as a family, we use them to help fill in forms and things like that, because the forms are, you get like a 400-page document that you have to fill in. And yeah, that for some people, they just don't have the time to do it. But if you're entitled to some support, you should take it. So, yeah, without question, the Dementia UK website.
Yeah, that sounds like the best place to go for sure,
Yeah,
doesn't
for
it?
sure.
So I don't know if you can answer this one, but I'm going to ask it anyway. Through your experience and the fact that you do the volunteering and your
Mhm,
wealth of knowledge on this topic, what could I do to reduce my own
mhm.
risk of developing dementia in the future?
Okay, I think it's the same thing, as we most people say, with any sort of illness, be physically active, eat as healthily as you can. Smoking and drinking do play a big part in diagnosis of dementia, for sure. They say avoid head injuries, which sounds simple, but obviously talk about people that have had head injuries, like boxers and things, that are more at risk of suffering from dementia and Alzheimer's. They suggest doing things like exercising your mind, so crosswords, trivia, puzzles, and all those sorts of things. And sleep is a big thing as well, to supporting with, obviously, anything to do with the mind and the brain, they say about sleep. But and also, if you have any other underlying conditions, then making sure that you manage those properly as well.
Yeah. Absolutely. That's really, really helpful. And like you say, it's
Mhm.
kind of like the common sense advice
It
for
is.
keeping fit and
Yeah.
well through life, isn't it,
Mhm.
really? So,
Yeah, for sure.
and I know you have been incredibly generous to offer your support to colleagues who might be experiencing dementia with a family
Mhm.
member or a friend or whatever, to be that sort of lifeline within Tate that
Mhm.
would be there to have a chat with so that you can share your experience and wisdom and point them in the right direction. So I'm guessing that obviously if anyone is experiencing anything like this, to reach out to you.
But yeah, absolutely. It's why I started doing the volunteer work in the first place, because I spent so long, and well, it was so difficult trying to find out who I needed to speak to, what I needed to do. And I thought, if there is if I can help one person, just try and make it a bit easier, that someone else has actually experienced this, then actually that's surely a good thing. So yeah, without question, if anybody has any concerns or they just want to chat, then I'm more than happy for that. Yes.
That's amazing. You're amazing, Karen, I have to say. I don't know how you
Oh,
do it
thank you.
all. It's just, and you just share so much. And thank you so much for your time. I know that
You're
it's
very
a
welcome.
bigger subject than what we've covered today, but it gives a
Yeah,
flavour of
absolutely.
a bit of an insight into the condition so that we all become much more knowledgeable. You
Mhm.
certainly taught me an awful lot more than I started this conversation with. 200 types. That is amazing. So,
Yeah,
gosh, thank you so much. And
you're
thanks for your
welcome.
time. And
Thanks, Becky.
we will chat soon, no doubt. So thank you.
Yeah, thank you.